Gonzalez. I'm a first-year graduate student for the COMT program in UTRGV. In this video, I'm going to explain to you the International Dysphagia Diet Standardization Initiative Framework, or the IDDSI for short. In the description box below, you will find a link for the IDDSI framework so you can follow along with me, as well as a video that demonstrates the use of thickening agents, which will be later described in this video. So before I begin, let me give a brief description as to what a speech-language pathologist does. So the American Speech Language and Hearing Association, or ASHA, states that SLPs work to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in both children and adults. So SLPs are going to work very closely with patients with dysphagia. They will usually conduct a bedside exam as an informal measure that gains clinical observation on the patient's condition. Observations from a bedside exam can be used as evidence to support the use of an instrumental exam. Such exams include the Modified Barium Swallow Study, or an MBSS, also known as a video fluoroscopy. This allows the SLP to gain a visualization on the function of the patient's swallowing, as well as to pinpoint what stage of dysphagia occurring. More specifically, an instrumental exam provides observational data that can answer the following question: why is the patient aspirating? The IDDSI defines their framework as a tool to describe textured modified foods and thickened liquids, used for individuals with dysphagia of all ages, in all care settings, and all cultures. Their framework categorizes drinks between levels 0 to level 4 and foods between levels 3 to level 7. Liquids can be thickened using a thickening agent to achieve the appropriate consistency to its respective level. The IDDSI implements testing methods so that the sample's consistency is the correct thickness when using thickening agents. The testing method utilizes a 10 milliliter syringe for a flow test, a fork for the fork drip test, or a spoon for the spoon tilt test. The flow test is used for liquids between levels 0 to level 3 and should utilize the following instructions. As of right now, I do not have a syringe with me on hand to perform the flow test on camera. However, the IDDSI does provide pictured instructions as to how the flow test should be conducted. To start off, you do need a 10 milliliter syringe to utilize this method, as well as a timer for 10 seconds. First, remove the plunger and hold the syringe between your thumb and index finger. Next, make sure your pinky finger is pressed against the nozzle. Once you cover the nozzle with your finger, fill the syringe up with liquid up until the 10 milliliter mark. Release the nozzle by removing pressure placed by your finger and start the timer. Once the 10 seconds have completely passed, cover the nozzle with your finger again. Check to see how much liquid is left in the syringe. Using this method can help determine what level of thickness the sample falls under. Now that you have an idea as to how to perform the flow test, I will be presenting video clips from the YouTube channel Nestle Health Science UK. So they provide detailed instructions when using this method on thickened liquids. So although I don't have a syringe with me on hand, I still wanted to show you how each liquid will look like. So let's begin with level 0. Level 0 are your thin liquids. So these are liquids that flow just like water. So this of course will include water, juices, tea, and as you can see when I'm doing the spoon tilt test, the water isn't going to hold its shape, it's going to flow just as water does. When you perform the flow test at home, if you have a syringe with you, you're going to notice that the thin liquids are going to dispense a lot faster than the other liquids. You should see no less than 1 milliliter of liquids remaining inside the syringe when conducting the flow test. So I'm providing a video from Nestle Health Science UK on YouTube. They are demonstrating thickening liquids. So in this precise video, they are showing level 1, or better yet, they're showing slightly thick liquids. These are liquids that are slightly thicker than water and require a little more effort to drink but can still flow through a straw. So as you can see, she's conducting the flow test. She's making sure that the nozzle is covered prior to applying the liquid into the syringe. She's going to set off the timer. It should be up to 10 seconds. So the way you can identify if it's at the correct consistency for slightly thick liquids is that 1 to 4 milliliters of liquid should be remaining inside the syringe. So as you saw in the previous clip, thin liquid is a huge contrast to slightly thick liquid. An example of slightly thick liquid that you can find at home is vinaigrette. If you have vinaigrette at home, you can definitely play with the consistency and use it in the flow test to determine whether or not it's appropriate for level 1. Usually it is, but since I don't have it with me, hopefully you have a syringe at home that you can perform the flow test with. Again, this clip is from Nestle Health Science UK on YouTube. In this video, they are demonstrating the flow test using liquids in level 2 or mildly thick liquids. This consistency can flow from a spoon, it's sippable, and pours quickly from a spoon. However, as you can see in the video, it's a lot slower than thin liquids. After the 10 seconds is complete, mildly thick liquid should have at least 4 to 8 milliliters of liquid remaining in the syringe. I don't have an example of level 2 consistency for the mildly thick, but you should notice right away that, of course, mildly thick liquids are a lot more thicker than both slightly thick and thin liquid. For the next level, which is level 3, you're going to see a consistency that's almost like syrup. So a perfect example that you can find at home is, of course, maple syrup, agave syrup. So you should see that it's a little bit thicker, but it still doesn't hold its shape compared to water. This video again is from Nestle Health Science UK. They are using level 3 or moderately thick liquids. This consistency can be drunk from a cup but cannot be sipped as easily. It usually requires a lot more effort and can be consumed using a wide straw. It can be eaten with a fork and does not require chewing. After the 10-second mark, there should be no less than 8 milliliters of level 3 liquid remaining inside the syringe. So the last level is level 4. This would be extremely thick liquids. So in the next clip, you will see a demonstration from the Nestle Health Science UK on how extremely thick liquids work. So an extremely thick liquid that you can find at home would be your condiments such as ketchup, mustard, barbecue sauce, mayonnaise. They have a lot thicker consistency than compared to the other liquids. So I actually have some mustard with me just in case you wanted to see. I'll show you a quick demonstration. So as you can see, the mustard's a lot thicker in comparison to the other liquids. It's holding its shape, and you can see that it's not flowing out of the spoon or spilling out of the spoon when I hold it. A common characteristic with extremely thick liquids is that you usually consume them with a fork or a spoon. So this makes it almost impossible to perform with a flow test, being that it's so thick. This is level 4 or extremely thick liquid. It should have a smooth consistency. It should not be sticky or firm, nor should it require chewing. You should be able to eat at this consistency using a spoon. Being that level 4 is so thick, it is impossible to conduct the flow test. The IDDSI recommends using the fork drip test or the spoon tilt test. In this clip from Nestle Health Science UK, they are using the spoon tilt test. The sample should hold its shape on a spoon and fall off easily when the spoon is tilted or lightly flicked. Thank you for watching this video. Hopefully this video explained enough so that if you don't have the materials at home to practice with, you can still gain a better idea as to how thick it works and how it impacts patients with dysphagia. I wanted to make it very clear that it's super important to understand that Thicket is not made for every patient with dysphagia. It's used for specific patients with specific problems in regards to their swallowing. SLPs need to work with patients as well as a collaborative team effort with other professionals to adhere to the patient's wants and needs. Occupational therapists really help SLPs with their expertise in adaptive devices, bettering the patient's posture, the position of their limbs, the visibility of tray items, and other motor sequencing involved in feeding. SLPs, what we do is we focus on the bolus size, on the food consistency, on decreasing the amount of aspiration occurring when they're swallowing, and techniques such as supraglottic swallow or the chin tuck technique, which can better adhere to the person's dysfunction in their swallow. So when we work together, we can really collaborate our ideas to not only better the quality of life of an individual, but provide a sense of individuality and independence when they're feeding and when they're swallowing during mealtime.